I'm Haley Taylor, and you're listening to the Rough Draft Diaries. It's been a while, but we're picking up with our connections on this episode of the Rough Draft Diaries. Today we're headed to ProMedica's Children's Hospital to meet a man who possibly has the best name that has ever been on this show. His name is Crawford Strunk.
I am a pediatric hematologist-oncologist here at Toledo Children's. I take care of kids with bleeding disorders and all sorts of childhood cancers, but my special area of interest is sickle cell disease.
Sickle cell is an inherited condition in which there aren't enough healthy red blood cells to carry adequate oxygen throughout your body. Normally, your red blood cells are flexible and round. In sickle cell, the red blood cells become rigid and sticky. They look almost like crescent moons or sickles, which is where the name comes from. And this abnormality in shape causes the poor circulation of these red blood cells, which then cause the health problems, such as attacks of pain, anemia, swelling in the hands and feet, bacterial infections, and even stroke. And although there's no cure for sickle cell, most treatments can help relieve pain and help prevent problems associated with the disease. It's also very rare, less than 200,000 cases a year. So how did Crawford Strunk become a sickle cell specialist in the first place?
So I did my residency at Geisinger Medical Center, which is in Danville, Pennsylvania, which is a very ethnically not diverse town that had a total of 3 sickle cell disease patients that I remember seeing. And they had every complication you could see. And when I did my fellowship at Rainbow Babies and Children's in Cleveland, I was trained by 2 very well-respected sickle cell experts, both Dr. Villela and Dr. Berman. And so when I came here, one of the things that my partner, Dr. Stein, recommended was pick an area of expertise and specialty that you're interested in. And I said, I'll take over the sickle cell clinic. And she said, great, here you go. And we've been developing the program ever since.
Development can also mean expansion, and that's exactly what ProMedica is doing. Just this month, they've started an adult comprehensive sickle cell clinic, and Crawford has been motivated to make it just as successful as the children's clinic. But Crawford's development as a doctor began long before his time at ProMedica, or even his time in Pennsylvania. He knew he wanted to become a doctor at the age of 5.
I remember being relatively young and having to visit the doctor and other things, and was just part of the routine. It wasn't anything odd or unusual, and the nurses were always nice and the doctors were fine, and so it just was part of my everyday existence. So I didn't know anything different, so just went along with it.
Crawford was born with a cognitive heart disease that required surgery when he was just 5 weeks old. So he became very familiar with doctors and nurses at a very young age.
I thought it was a positive experience. My parents obviously were very worried and stressed about me and how I was going to do growing up, but they raised me to be a normal human being, a normal person as much as possible. Give you an example, my mom tells a story all the time. I was at the doctor's office and jumping off chairs and being crazy and typical, 3 or 4-year-old stuff. And my mom yelled at me and said, you sit down and you behave. You're not supposed to act this way. And apparently one of the candy stripers who was there was like, you can't say that to him. He's a kid who has heart disease. And she said, you know what? I have to live with him for the rest of his life, too. So I'm going to make sure that he's behaving the way he should. And and to this day, I'm honored and happy to know that she did, because without that, I wouldn't have been able to be where I am today.
And Crawford experiences this mentality today in his day-to-day, not so much in the parents that he meets, but in the misconceptions that surround his work and his patients.
The one thing I hear all the time from people is, oh, it must be so sad because those kids are always so sick, and don't they all die? And I say, well, most of them are treated as outpatients. Some of them can get very sick, but all in all, we treat and cure about 80% of our patients. And that, to me, is just the best thing in the world. There are some valleys, and we recognize that, but there is in every field of medicine. And we always look to the positive, and keep moving forward.
Looking to the positive and moving forward is best for Crawford when it happens for the kids, when they are able to ring the bell and go home.
So on our ward, we have a bell that patients who've come off therapy are able to ring, and so we just had a little 3-year-old boy be able to do that. 4-year-old, he's 4 now. 4-year-old boy be able to do that this week, and so it was awesome. He just rang it nice and loud and nice and strong. So it's good. So.
I'm Haley Taylor, and thanks for listening to this episode of the Rough Draft Diaries.